As we reopen our offices, I'd like to address some concerns as we resume our practice after lockdown. Let's start with the most important concern, which is what is being done to minimize the risk of spreading the COVID-19 virus. Throughout this lockdown, our office has been functioning remotely with our full staff, and we've been working together virtually and monitoring the ongoing information being generated from throughout the world about COVID-19. It's been interesting to see how information being presented by what appears to be reliable sources is often immediately dismissed, discredited, and contradicted. It's also interesting to note how the general public has become more aware of the conflicts of interest and financial incentives responsible for biased research that has existed for many decades in medical research. This means that articles published in so-called prestigious journals need to be scrutinized by objective experts before trusting the conclusions of these studies. For example, an article specifically about therapy for COVID-19 published in The Lancet was recently retracted because the data from the study could not be verified by independent investigators. We've all seen how contradictory guidelines, such as the utility of masks, has created considerable confusion and even paranoia. Throughout this time, I've been doing my part of scrutinizing the medical research and worldwide epidemiology and providing my interpretation for my staff and my patients. As far as your safety is concerned, as a medical and surgical practice, we already have processes in place to minimize the risk of any infection with established practices such as hand washing and disinfection of surfaces. In addition to our usual routines, we will follow the recommended standards and guidelines from the CDC and the New York State Department of Health. This pandemic has revealed a lot of vulnerabilities in our health and has further strengthened my resolve to help our patients to achieve optimal health. As most of our patients are aware, I deeply believe that optimal appearance and optimal health are two sides of the same coin. Many of my patients would attest to how much time I spend in discussing health, lifestyle, exercise, in addition to aesthetic treatment planning. Inspired by recent events, I've created a more formalized concept of wellness as part of our practice through a systematic approach we're calling vitality. Vitality means looking your best and feeling your best. This vitality can be achieved through your lifestyle, diet, supplementation, exercise, and other optimal health strategies, which generally correlate very well with your immunity. Another concern I'd like to address has to do with scheduling. My staff and I are committed to be flexible, as we always have been, to expedite your services to suit your schedule. As I stated earlier, I have been continuously seeing new and established patients using FaceTime and Skype, so we actually have a lot of people planning to come in as soon as we're open. My front desk staff and patient coordinator will do their best to schedule you and at the same time comply with the government-defined limits on the number of people we can have in our office at any given time. As we go through the phases of reopening, I know we're all excited about getting back to our normal routines. I'm certainly looking forward to the next available appointment at my hair salon. My staff and I are very excited to see our patients and catch up with all the scheduled services which were abruptly put on hold before the lockdown. As we've seen throughout this pandemic, official guidelines for public safety continue to be adjusted as scientific data is interpreted and enacted into public policy. As these policies evolve, we will adapt and stay vigilant to protect our patients, our staff, and all of our families. Thank you.